Earlier this month, we released a report entitled Cancer Facts and Figures for African American Black People. In this report, we detailed some alarming findings, one of which is that Black people are more likely to die from most cancers and live the shortest amount of time after a cancer diagnosis than any other racial or ethnic group. The reasons for these disparities are complex, but largely stem from less access to high-quality care and optimal treatment as a repercussion of long-standing institutional racism. There is some good news, and the good news is that the overall Black-white cancer disparity is slowly narrowing, mostly due to a steeper reduction in cigarette smoking by Black people than white people in the 1970s and 80s. African American people are overrepresented in states that have not expanded Medicaid. Expanding access to Medicaid in those 12 states that have not yet done so will help reduce the burden of cancer in African Americans. Because of the high cost of cancer, many people, and those who have had cancer and those who have survived cancer, experience financial hardship, including problems paying bills, depletion of savings, delaying or skipping needed medical care, and potential bankruptcy. These costs and hardships do not impact all cancer patients equally. So there are a few things we know that we can do to address cancer disparities. We need more research, including clinical trials on the risk, screening, diagnosis, and treatment of cancer that is more inclusive of Black people to reduce these disparities. We also need to address issues around medical mistrust, which is a direct result of structural racism. And we also need to ensure that we have healthcare providers that reflect the patient population. Bottom line is that we need more African American physicians, nurses, and researchers working in the field. And ACS is working to help diversify the workforce through our investment with the 4 HBCU medical schools and our Diversity in Cancer Research Internship Program. The American Cancer Society and ACS CAN are committed to improving the lives of cancer patients and their families across this country. And we know that doing so will require us to address health disparities that are erecting barriers to equal access to cancer prevention, screening, treatment, and survivorship.